that made a lot of headlines in the last week. Flossing. Associated Press with a report saying there was no evidence to back up claims that you need to floss. Well, we need to get to the bottom of this. Dr. Doug Hamilton, dentist in Westmount, joins us now. Thank you for joining us this morning.
Hey, good morning. Good morning.
So you hear this news, and the Associated Press, they asked the Department of Health and Human Services in the States, hey, can you give us the evidence? They filed an access to information request. And then, quietly, they remove flossing from their list of guidelines. That's what's caused all this ruckus. You're in the trenches every day. You're in our mouths. Do we need to floss?
Okay. So, to be very clear, absolutely you need to floss. Absolutely. And this is a bit of a red herring. It's a great story. It's interesting and fun to challenge something that we know is obviously something we should do. But absolutely floss. So what is really going on here? It's a battle with science. So science has to be precise, very precise.
And proven.
And proven. And in order to do that for flossing, it's very complicated because it sounds easy. But to study flossing, you have to know that people floss every day. Do they floss the right way? Do they take a week off? Are you going to go in their washroom and watch them flossing? You're not going to do that. So to study flossing, it's actually really difficult and incredibly expensive. It'll be at least $10 million to do the study, and then you're going to want to repeat the study because science requires that different centers can duplicate the same data. So to get scientific verification, it's expensive. It took 40 years to show cancer was caused by smoking, and hundreds of millions of dollars were spent on that. So are we really going to spend this on flossing? It's something that's obvious that we should do. We don't need to do that.
I'll give you the counterpoint here, and I have these people that are in my office that are very smug about it. Oh, I never floss. My teeth are perfect. I hear that story too. I floss every day, and those people, they say that to me, and I'm like, oh, I have to floss every day to keep my teeth in good shape. So what about these people that seem to not floss and they have magical teeth?
Why don't you do the taste test? Well, maybe the smell test. But if you line people up and smell their breath, the ones that floss smell better. Yeah. So cosmetically, there's benefits. There's also benefits in that we do know that when we relieve you of the burden of the bugs in your mouth, the biofilm, we call it the biofilm, it's that slime that forms on your teeth. You've heard dental plaque. You get dental plaque above the gum and below the gum. They're a little bit different. The bacteria below the gum cause gum disease. The ones above cause decay. So it seems simple. If we have an acid environment caused by the plaque, if we lift the plaque away, will prevent decay.
If you don't floss, what are you at risking here? If you're going to say, okay, you know what, I saw this study, flossing is not for me anymore, I'm not going to floss, what do you risk?
Right. So in dentistry, 95% of what we treat is behavioral disease. Gum disease, by and large, mostly is a behavioral disease, and so is decay. It's the things that you do or don't do that cause the disease, and flossing is a big part of healthy behavior. So if we relieve ourselves of the burden of the biofilm above and below the gum, we stop bleeding, we stop bone loss, we stop gum disease. And if we relieve ourselves of the biofilm above the gums, we stop tooth decay. So if we, for example, for decay, if we have acid on the teeth, because we drink acidic fluids like Coke and Pepsi, and we have sugar in all of the foods that we eat. The food companies are very good about that. They give us lots of sugar because they know it's addictive and it drives consumption and makes us fat.
And you must love it because it means more people are in your office with cavities.
This is absolutely true. I've been in dentistry for 35 years. We get unusually exceptional health outcomes because we do insist on all these preventive things that we do, right? Flossing is a big thing for us. But in spite of all of that, we have seen a rise in the decay, especially for our new patients that come in. So particularly in that age group, beyond 25, these people have usually settled down. The mature enamel in their mouth is resistant. Normally we don't get a lot of decay, but today we are seeing a tremendous amount.
I got time for one quick question here. And so flossing, you got to do it, but there's all these other products that people are trying to push through, like oral rinses, kind of stuff.
Don't rinse.
No rinses.
Waste of time for most people. Yeah, it's a $2 billion industry. That's what you can imagine these people thinking about new products. How about one we spit out and waste it? Sure, that'd be great. Every day, everybody uses it. But it doesn't really do very much because it doesn't penetrate under the gums to cure gum disease. Now, there are a limited number of rinses that you can use, and you can talk to your dentist about it, that can be of value. But most rinses are really not useful.
Okay, good to know. You got to floss. Thank you so much.
Yeah.
That's Dr. Doug Hamilton, dentist in Westmount.